long. Ann Coulter coming up next in another few minutes. So stay where you are. Then Tom DeLay after Ann. But joining us right now is Dr. Robert Goldberg, co-founder, VP of the Center for Medicine in the Public Interest, also writes for the blog on the pharmaceutical industry and healthcare at www.drugwonks.com. Hey, doctor, how are you?
I'm doing fine. How about you, Steve?
I'm doing fine, thank you. Boy, oh boy, I'll start this interview the same way I started the last one. Think I'll get a different reply, though. What a mess this Obamacare thing is, huh?
Well, if you love the rollout, you'll be a fanatic for the quality of care that you'll get.
Well, okay, I was talking to Sally Cohn of Fox News and the Daily Beast just before, and of course she thinks that hundreds of millions of people have already reaped the benefits. We only have 300 million in the country, so I don't know how many hundreds she's talking about. Neither did she, by the way. But I was talking to her about how I had a conversation with Tom Daschle on the air. He was the originator of Obamacare. He wrote it, basically. He couldn't be confirmed because he was a tax cheat. And I'd asked him on the air years ago, I said, so what happens to an 85-year-old guy who needs a bypass? Well, give him a pill or put him in a hospice. Now, we are a society that not only values our elderly, but we do everything humanly possible to keep them alive and comfortable as long as possible. And now under Obamacare, all that changes.
It does change. And I've heard the argument that about pre-existing conditions and so on. Well, the fact of the matter is a very small percentage of people have a lifetime limit on their policies. I mean, that's pretty much been baked into the cake. So that's not really you can give Obamacare a little bit of credit for that, but not much. The real crux of the issue is exactly what will be the quality of care and how much will you pay for it if you can find it. And it turns out with cancer patients, for instance, that people who were used to paying $70 a month for a life-saving drug will now have to pay $2,000 a month because it's the same plan but different coverage. And by the way, it's just not under Obamacare. You know, people that you remember, of course, the famous pledge: if you like your insurance, you can keep your insurance.
And your doctor, yes.
Well, you can, except that you're just going to have to pay a fortune to do it. So in the state of New Jersey, the Garden State, the home of the 0-6 Giants, which is a whole other story.
Well, we'll see after tonight. The Devils were 0-6 too. It took them seven tries. But go ahead.
That is true. And the 800,000 people who have health care already before Obamacare, are finding out that their networks of doctors are smaller. Their copays are bigger, and if you're a patient with a chronic condition, you're going to pay thousands and thousands of dollars to stay with the drugs that you have and the plan that you have. That's not good.
No, absolutely not. And deductibles, like I said to Sally, I said, all I keep reading about now are these people who are going on, looking around, and they think, the premium isn't so bad, and then they get into the policy, and the deductibles are $5,000, $6,000, $7,000, and I've never heard the word deductible uttered by Barack Obama or a Democrat ever.
Yeah, what was what was her response? I mean, there's not much you can say, except that it's going to cost more. It's going to cost a lot of people a lot more, and this was such an easy problem to fix. If you just allow people to buy catastrophic care on the open market, and then allow people to get access to the latest and best medicines, using drug benefits and treatment centers that we know are designed to keep people out of the hospital. And we've cut the cancer survivor, the hospitalization rate of cancer patients by 50% because of access to new medicines. Now, under Obamacare, the next time that a health plan is required to add new medicines, and you think, they're pumping them out,
Sure, there's always advances, yeah.
Yeah, in 2016. So if you're a health plan, you are now under no obligation to add a new drug. So as an example, there's a new drug that will keep you out of the hospital and avoid surgery for breast cancer if you have a particular mutation. Well, most of these plans, that was approved last month. None of these plans
cover it.
Cover it.
Yeah. Yeah. I got one for you. We're talking to, by the way, Dr. Robert Goldberg, co-founder and vice president of the Center for Medicine in the Public Interest here on the Steve Malzberg Show. There's a report on the Daily Caller that a 2009 report by the Center for American Progress examining the bill eventually signed by Barack Obama advocates pairing patients and doctors of the same race, which they call a goal towards the law using taxpayer dollars. Here's the quote from the report. Research suggests that healthcare providers' diagnostic and treatment decisions, as well as their feelings about patients, are influenced by patients' race or ethnicity. Several studies have shown that racial concordance is substantially and positively related to patient satisfaction. Now, the key phrase here, they claim, is race concordance, a word which means a state in which things agree and do not conflict with one another. So, of course, this is open to interpretation, but the fear is that they're going to try to have, black doctors see blacks and white doctors see whites, and who knows, maybe Jewish doctors see Jews.
Well, there's got to be a punchline there somewhere, Steve, but I'll think about it. All I can say right now is that it's an insult
to doctors.
The thousands and thousands of doctors.
Absolutely, implying that doctors are racist. That's what the whole thing implies, that white doctors have no empathy for non-white patients. That's what this whole thing is about. And doesn't it fit in with the whole Obama philosophy? Yeah,
I just find it surprising but not shocking.
Yeah.
Any more than I find that the first cuts made to Medicare were to people in hospice.
I know. It is insane. All right, so now the president comes out today very briefly here and says, hey, this is a great product. I can't wait for the cash registers to go ching, ching, ching. And, we got a little glitch going here. But don't worry, Obamacare is more than a computer program. It's just insane. And now they want you to call on the phone or go in person. And I'm like, go in person where?
Well, I thought that this was supposed to be a shopping experience as easy as Amazon. Remember that?
Yes.
Remember that? I can remember, not to turn it into a sports show, but when they handed out the Mario and Rivera bobbleheads,
and they didn't have them,
there was a near riot. Now, people are being a lot more patient with Obamacare, but frankly,
nobody wants Obamacare. They wanted the bobblehead dolls.
Yes, exactly. Exactly.
Oh, boy. Listen, Doc, I really appreciate it. We'll speak to you again. Keep up the good work, and you're the lead-in today to Ann Coulter. So,
tell her I have a crush on her, even though she's never met me, and vice versa.
There you go. I will make sure to do that. Sorry, I think she's she used to be in love with Chris Christie, and now her favorite Democrat is Cory Booker. So I don't know how strong that feeling is, but anyway, I appreciate. And now her favorite Democrat is Cory Booker. So I don't know how strong that feeling is, but anyway, I appreciate. The aforementioned Ann Coulter, her new book, Never Trust a Liberal Over 3, especially a Republican, which means rhino, which begs a lot of questions in my mind. And we'll ask Ann when we return on the Steve Malzberg Show, Newsmax TV and radio. When we return on the Steve Malzberg Show, Newsmax TV and radio.